But when we're talking about weight gain, obviously this is a concern during menopause and in the years after. And my question as we were having lunch back there was, why? Why? Why does it happen here and here? I don't understand. It hurts. So talk a little bit more about what's really happening with a woman's body.
Um, well, I think that it is really common to gain weight in menopause, and they say typically about 1.5 pounds per year, and it can be average. Not 70% of women, I think, will gain weight in menopause. It may be even more than that. Um, so if you think about the menopausal transition lasting roughly 10 years, that potentially is 15 pounds. It's a lot of weight that can occur. And especially if you already have overweight or obesity, that any significant weight gain can really kind of change things. And we think that it has to do with the kind of redistribution of adipose tissue, fat tissue, and the reduction of lean muscle mass. We think those are the biggest driving factors, and it has to do with lowering our metabolic rate. So we burn less calories at rest as we go through menopause. I also think that, or not I, but it also seems that aging is part of it, right? A 10-year period is 10 years. That's, we burn less calories as we get older. And then there are some studies that say also that women in their 50s spend less time being physically active. They participate less in leisure activity. So, changes can occur through that period where you're less active than you used to be. And there are so many things that might be pushing that. For instance, all of the menopausal symptoms can really make it hard to be as active as you might have been before.
Can you talk a little bit more about redistribution, as you call it? Because I'm curious, it seems to happen in the same place for so many women. Is there an answer for that?
So you're saying why?
Why here?
Yeah.
Why here?
Yeah.
It's not normal. My
Well,
pants don't fit, and I could do 500 sit-ups, and they still aren't going to fit properly.
so we gain visceral adipose tissue, right, around the waist, and I actually I don't know. One of the things that we still don't understand is how. We know it's normal, it happens, but is there an adaptive part of it, right? Some weight gain may be protective. It's not that all weight gain is actually unhealthy. Of course, when you're having too much adipose tissue around your organs, we know that that can be associated with metabolic disease. So I guess the answer is why there? I don't think I have the answer why there.